Hello and welcome to this channel. My name is Victoria and today I want to talk about foreign bodies in the nose and nasal furuncles. Also, I will talk about the triangle of danger in the face. So now I want to talk about the introduction of foreign bodies in the nose. It is a type of accident which is especially common in children. They might put small toys, tissues, food, pebbles, dirt, magnets, or other small objects in their nostrils, but it can also happen when inhaling something when working close with dusts or small objects. Some items, as for example button batteries or other toxin-containing small objects, can cause acid or chemical injury to the nasal passage. Classically, foreign bodies can be of three different types of origin. Either the object is organic, so bugs and other living creatures, inorganic, which means plastic objects or metal objects like earrings, small parts of machines, batteries, but also they can be of iatrogenic origin, which means the object is medical equipment, like bandages, clips, or other materials. There are different signs of having a foreign body in the nose, but usually the patient will tell you when he is aware of the presence of some object. Also, sometimes objects are not possible to see, but they cause also other signs, as for example nasal drainage from the nostril, which contains the object, as a kind of compensatory response to try to eliminate the object. Depending on the object and its chemical composition or damage to the nasal passage, it can cause clear, gray or yellow greenish or maybe sometimes even a bloody secretion. Also, a sign for mechanical obstruction of the nasal passage by an object is the presence of breathing difficulties, which will create the sound of having a bird in the nose or a sound of whistling. The diagnosis is usually made by the use of a rhinoscope with a light on its front part to inspect the nose while the patient is looking up. If necessary, the patient can also lie on his back. The object is usually mainly found beneath the inferior turbinate or anterior to the middle turbinate. Also, a nasal swab of the secretion might be indicated to eliminate the presence of bacterial cultivation within the nasal passage. Especially when the secretion is yellow-greenish in color, the presence of bacteria is to be thought of. To remove the object, you can first ask the patient to gently blow the nose, or you could alternatively try to make them sneeze. These are also advices usually given to parents to try at home in case their child has inserted something into their nose, voluntarily or by accident, into one of their nostrils. At home, it's for example possible to try to make a child sneeze with pepper. In case of a larger object, you can try to remove it with tweezers, usually those with a bended tip, but it depends on the surface and the size of the object. If the object is too small or has a smooth surface, then trying to remove it with a tweezer might lead to further pushing into the nose. Foreign objects also might lead to a variety of complications, including superinfections by bacteria, vestibular rhinitis, sleep apnea, facial cellulitis, sinusitis, and also septal perforation and interior turbinate necrosis. The next topic I want to cover are nasal furuncles. Those are localized purulent inflammation of fat glands or hair follicles, which is restricted to the nostrils or the skin around them. Most commonly, they are caused by staphylococci and streptococci, and furuncles have the form of an abscess and can occur in every hair-containing region of the skin. They appear red, indurated, and painful with a central necrosis. Also, heat formation and tenderness are seen as a sign of inflammation. The formed pus is drained to the surface of the skin. It often heals with scar formation, which is depending on the size of the furuncle. Self-treatment of patients by squeezing and popping might make the situation more severe. There are a variety of risk factors, reaching from cellular immunity defects like leukopenia or metabolic disorders as diabetes mellitus, to plucking of nasal hair, nose picking, or the introduction of foreign body in the form of nasal piercings or other accessories. Also, excessive nose blowing, for example in periods of severe and prolonged allergic reactions or the common cold, can promote the inflammatory process. Now I want to talk about the therapy of a furuncle. Primarily is used the ichthyol cream. Due to its ammonium bituminosulfonate, It works antibacterial, against inflammations, and against itching. It also decreases the formation of pus and increases resorption and phagocytosis of the purulent debris. If necessary, a surgical intervention with the introduction of an antibacterial strip is possible to secure the drainage of the secretions. In case of larger furuncles, systemic antibiotics can be necessary, especially if it is caused by Staphylococcus aureus. As an advice for patients, especially for those with recurrent presence of furuncles, is to not to try to pop it with a needle or try to squeeze them, especially before a yellow head was created. If the furuncle should be opened, the skin in this area should be cleaned properly. The person should wear gloves, and rather than pushing the skin, it can be slightly pulled away and then slightly pushed together in an alternating movement with great care and without force. Complications of furuncles include abscess formation, chondritis of the cartilages forming and surrounding the nose, and cavernous sinus thrombosis. The cavernous sinus is a sinus in the cranial cavity, posterior to the eyes, between the layers of the meninges. Bacteria can spread there and form a thrombus. Symptoms of this complication include headache, facial pain, fever, and double vision. Also, spread to the bloodstream is possible. An additional risk of spread of these infections and other infections is the presence of the so-called danger triangle in the face. This triangle is formed by the angle of the lips, then it goes along the nasal wings to the root of the nose, and it includes the nose and maxilla. Due to the blood supply in this area, the communication via the ophthalmic veins between the facial vein and the cavernous sinus makes it possible, yet unlikely, that infections can spread to the brain and cause cavernous sinus thrombosis, meningitis, or cerebral abscesses. That's all for this presentation. I hope it was helpful. And if you have any questions, just let me know. I will try to answer. And also like and subscribe if you liked the video.